Good evening, everyone, and welcome to another episode of A Closer Look, the show dedicated to bringing you the facts. We ask the questions no one else will, and we get the answers that no one else can. Tonight, A Closer Look comes to you live from Grand Bahama Island for a special two-part episode. Tonight, we begin our comprehensive coverage of the groundbreaking of the new Freeport Health Campus, and we take an in-depth look at the future of healthcare services here and throughout the country. I'm Arabina Apia. Thanks so much for joining us. It is an exciting day in the history of the nation's second city, ladies and gentlemen. For residents here, fingers crossed, it marks day one of a revolution in healthcare that this island so desperately needs. For years now, residents accessing public health care have had to deal with aging facilities and limited resources. In fact, getting the health care we need has meant that many of us have had to travel off-island to receive care. By now, you've all heard the stories. Stories of how severe flooding during the passage of Hurricane Dorian severely compromised the Rand Hospital. But if you're a resident here, then you know that the hurricane only exacerbated some issues already festering in the corridors. Add to that the impact of a global health pandemic, and what you have is a perfect storm of unprecedented challenges for our little piece of paradise. Like Hurricane Dorian, the COVID-19 pandemic further highlighted the need for modern, effective healthcare services and infrastructure, which is why today is such a big deal. This groundbreaking represents phase one of three-part construction for the island's new hospital, and to be honest, it couldn't have come at a more critical time. As Grand Bahama continues to undergo a renaissance of sorts, this facility, which, as I said, is phase one of a brand new hospital, represents significant investment in the country's and the island's infrastructural development. More importantly, it's a step toward finally giving Grand Bahamians access to comprehensive healthcare services that they need and deserve. And if you love Freeport like I love Freeport, then say it with me. It's about time. Over the course of this two-part show, you will hear from executives of the Public Hospitals Authority, major players within the Grand Bahama Health Services, government, and port officials who will all shed some light on the way forward. So, stay tuned, because A Closer Look begins right after the break.
Do you have a business idea that is innovative or creative? Well, I've got some great news for you. The Grand Bahama Port Authority has launched its new Business Diversity Waiver. The Business Diversity Waiver applies to new businesses only, and all successful applicants will receive their first year business license fee at a discounted rate or free. In order to be eligible, the new business should create a minimum of 2 jobs, meet all zoning requirements, and not fall into a business category that is considered saturated or restricted, such as clothing, beauty supplies, liquor stores, or takeout restaurants, just to name a few. If your business model does fall into a saturated category, it must include a special component, something that sets it apart from the others. With the Business Diversity Waiver, we encourage you to think out of the box, using your talents and hobbies creatively to jumpstart your entrepreneurial journey today. For more information or to apply, contact us at 350-9050 or at info@gbpa.com.
Welcome back. You're watching A Closer Look. I'm Arabina Apia, and I am coming to you live from the groundbreaking of the new Freeport Health Campus here on Grand Bahama Island. In an era where Bahamians continue to grapple with non-communicable diseases and their impact on their overall well-being, the state of healthcare on Grand Bahama Island takes on even greater significance. These chronic conditions such as diabetes, heart disease, and hypertension continue to pose significant health challenges, making access to effective and affordable healthcare services even more important. We took a closer look at the current state of healthcare and how Grand Bahamians have been faring. Let's take a look. For years now, health systems on Grand Bahama Island have been plagued by outdated infrastructure, a shortage of trained medical professionals, limited resources, and aging facilities that have struggled to keep pace with the demands of a growing population. Post-Hurricane Dorian, the delivery of healthcare services suffered even more, with the island's major healthcare facility, the Rand Memorial Hospital, as well as the surrounding clinics, experiencing extensive damage due to flooding. The storm left many communities on the island without access to essential medical services, exacerbating an already fragile situation. Despite the challenges, however, there is now a glimmer of hope on the horizon. Efforts are underway to transform the healthcare services on Grand Bahama Island. Rand Hospital Administrator Jessica Cartwright sat down with the ACL team as part of a special roundtable discussion where she described the healthcare situation on the island as being in a state of transformation.
There is a lot going on in Grand Bahama Health Services. We are seeking to reinvigorate and to reestablish services that would have been paused as a result of both Dorian and COVID. And then, of course, as you mentioned, we are here for our health campus. And so we're going through the whole exercise of understanding what we would like our health system to be in the future and planning towards that. And so it's an exciting time in Grand Bahama Health Services. Clearly, like most systems, we have our challenges, but in terms of the team and where we're going, we are very focused and very excited.
The government and the Public Hospitals Authority broke ground on what will be phase 1 of that island's brand new hospital facility. The Freeport Health Campus represents a multi-million-dollar investment aimed at revitalizing and modernizing healthcare facilities on the island. Coupled with initiatives such as recruitment for healthcare professionals, training programs, and partnerships with regional and international institutions underway, these efforts, officials say, will enhance the quality of care and ensure sustainable health care for residents across the island of Grand Bahama. Stay with us. Our deep dive into Grand Bahama's healthcare revolution continues after this.
Freeport Report encourages residents to become active citizens in improving our city by reporting non-emergency issues in their neighborhoods, all through the convenience of an easy-to-use and free mobile app. You can instantly report issues from within the GBPA areas, quickly map issues you see on the street, answer a few questions, provide detailed descriptions, photos, and videos right from your device. Whether it's your neighbor or the responsible department within GBPA, those who need to know will receive an instant alert of issues reported. You can also comment on issues, vote them up, and share issues on Facebook and other social media sites to get even more citizens involved. You can report matters such as illegal dumping, unpermitted construction activity, damaged water meters, and a host of other issues that may affect your neighborhood and the city at large. We all want to make our city comfortable and issue-free, and now there's an app just for that. Keeping our city well-managed and beautiful just got a little bit easier. All you have to do is see, click, and fix with Freeport Report. Download the Freeport Report app today. Available for free in Google Play and the Apple App Store.
Welcome back, ladies and gentlemen. As the Bahamas strives for comprehensive and forward-thinking healthcare, the integration of cutting-edge technology and sustainable practices into the design of this new facility brings a new level of promise and possibility. Phase 1 of the all-new Freeport Health Campus is set to hopefully revolutionize healthcare in the nation's second city. The cutting-edge facility will incorporate innovative technologies and features aimed at improving patient care and outcomes. From design to construction, officials say every aspect of the project has been carefully planned to provide the best healthcare experience for patients visiting PHA hospitals across the country. According to PHA executives, the new facility will be equipped with advanced medical equipment and integrated information systems, allowing for seamless communication and coordination between healthcare professionals. Electronic medical records, telemedicine capabilities, and real-time monitoring systems will enable efficient and personalized care, leading to better patient outcome. Well, it's these improved patient outcomes that were a major factor in the planning and design of the new Freeport Health Campus. That's according to project manager John Michael Clark.
The outcomes of the design is the latest modes of healthcare operation for the delivery of clinical outpatient care. So in the first phase, we have a lot of clinical pods. These are pretty much open areas. The patient and the back of house areas are clearly delineated. So you don't have staff crossing patients. The patients don't see what's going on in the background. And the whole idea is to create an environment where patients feel welcomed and comfortable in the space. Healthcare is moving away from the sterile hospital type. You want to have a building that has a lot of natural light.
Even more important, however, are the steps being taken in the design to improve the site's environmental sustainability and weather resiliency. According to Clark, the design and construction of the facility prioritizes energy efficiency and resilience against severe weather conditions such as hurricanes.
There are certain sustainability elements that we want to achieve. So we'd be using elements such as water savers for the plumbing fixtures, LED light, low energy intensive light. We have concrete panels and those are insulated. So it's a very, very energy efficient structure. In terms of where it is, it's a little bit more inland. It's almost near the middle of the island. It's in the less vulnerable area, but given the nature of Grand Bahama, we can't say that there's any place that is absolutely vulnerable free. So what we want to do is we want to mitigate the risk. And this location is a better mitigation of flood risk than where the Rand Memorial Hospital is existing.
It was back in 2019 when the Rand Memorial Hospital was severely compromised due to flooding from Hurricane Dorian, which exposed some major cracks in healthcare infrastructure and the overall delivery of healthcare services as well.
Hurricane Dorian came across Grand Bahama and pretty much totally crippled healthcare services on the island. There was an aggressive restoration program that was done in collaboration with a lot of the local contractors and the Capital Development Unit of the Public Hospitals Authority. Over $20 million was spent restoring healthcare services to a point where people can have consistent care at the present Rand Memorial Hospital site. That happened not only in the hurricane environment, but by and large in the COVID environment. So you had a confluence of these two things happening at the same time, where Hurricane Dorian was already a catastrophic event, and then you had COVID that exacerbated that catastrophic event. And it's in that environment that you were trying to restore hospital services.
Now, according to Clark, though, the Freeport Health Campus's design and construction is part of the PHA's wider strategy to stormproof healthcare on the island of Grand Bahama as much as possible. He says that as the facility takes shape, the community can look forward to a healthcare center that prioritizes patient well-being, resilience against severe weather, and a greener future overall. Stay with us, ladies and gents. When we return, we take a closer look at plans to attract new blood in the world of healthcare services here on Grand Bahama. You don't want to miss it. You're watching A Closer Look. I'm Aravana Apia, and I'm coming to you live from the groundbreaking of the brand new Freeport Health Clinic on Grand Bahama Island. As we navigate the ever-evolving landscape of healthcare, one crucial challenge continues to be the shortage of skilled professionals, from nurses to doctors to other essential ancillary services. This shortage not only impacts the quality of care that can be provided, but also put a strain on the healthcare system as a whole. However, in the face of these challenges, plans are being set in motion to address these critical gaps and ensure strong and capable healthcare workforces across the country. Let's take a closer look. The Western Atlantic School of Medicine officially welcomed a cohort of 27 new doctors to its ranks. The Grand Bahama-based medical campus held its 5th white coat and pinning ceremony at the Grand Ballroom of the Grand Lucayan Hotel in the nation's second city. Graduates of the program, which included students from the United States, Canada, and of course the Bahamas, were honored for their dedication and hard work, marking an important milestone in their medical careers, one which PHA Managing Director Dr. Abinette Roll reminded them must represent more than just a job, but a deep and personal commitment.
Sometimes it may feel like you are all alone and overwhelmed. What will sustain you in those dark moments is the same individual and personal commitment to heal and to serve, which inspires you today to take and wear the white coat. Separate from your individual commitment is your commitment to the patients you will serve. The commitment that I speak about is the willingness to work hard and give your energy and time to the profession.
The pinning ceremony, held just days ahead of the groundbreaking on Phase 1 of the island's brand new hospital, fits into the larger PHA strategy to strengthen the healthcare workforce. According to Dr. Roll, these newly graduated doctors are a valuable addition to the overall plans of the Public Hospitals Authority to attract new blood into the nation's healthcare ranks. This with a view to meeting the growing needs of the island and the country's population. The new doctors will have the opportunity to serve in various capacities, from primary care physicians to specialists in different medical fields, with their presence helping bridge the gaps in healthcare services, particularly in more underserved areas, while enhancing the overall quality of care provided to the Bahamian public. She encouraged the new physicians to not only be technically savvy, but to demonstrate a commitment to compassion as well.
When patients see committed caregivers, it communicates that they can exercise a level of trust and confidence in the medical team. This also extends to being compassionate. We don't only require doctors who are technically savvy, but who can also demonstrate the virtues of compassion and empathy. Like Henry Newen questioned in his book, The Wounded Healer, and I quote, "How many patients will leave the hospital healed of their physical illness, but hurt in their feelings?"
Well, looking forward, the Public Hospitals Authority is looking to expand the capacity of medical education in the country. Through its PHA Academy, the authority has implemented mentorship programs, continuing education opportunities, and professional development initiatives to ensure the growth and success of new doctors in the field. Stay with us. Our show continues after this short break.
Sometimes we focus so heavily on the minor details that we miss the bigger picture. Take a step back. See how our efforts make for a bigger, better Freeport, a bigger, better country. Let's make Grand Bahama grand again.
Welcome back. You're watching A Closer Look. I'm Arabina Apia. Thanks so much for joining us. As one of the leading authorities at the forefront of healthcare in the country, Dr. Michael Darville joined me for an exclusive sit-down interview at the Pelican Bay Resort, where he shed light on the government's plans to reform our nation's healthcare system. In part one of our two-part interview, he speaks to his ministry's vision not just for Grand Bahama, but for the entire country. Let's take a look. Ground is officially broken on the new Freeport Health Campus on Grand Bahama Island, and joining me now to discuss all of the government's plans is the Honorable Health Minister, Dr. Michael Darville. Welcome to the show.
Thank you.
I want to thank you so much for being here. This is an exciting time for Grand Bahama, and I want to talk to you about the government's overall plans. The ground has now been broken on this new Freeport Health Campus, but can you speak to the government's overall vision for healthcare and tell us how Grand Bahama fits into that overall vision?
Well, thank you so much, Robin, and it's good to be on the show. I'm so excited to be in Grand Bahama for the official groundbreaking for the new Freeport Hospital. It's a phased approach. Phase one, we start, and then we move into phase two, hopefully within a short period of time, to begin the construction after we do the capital works, where the residents of Grand Bahama can see the vertical construction of this new facility. And so where we are today is based on the amount of work that we did in our para administration, and now we are definitely on the ground now to break ground here in Grand Bahama.
Well, Minister, I'm glad you shared that vision, and we spoke with the Prime Minister at the groundbreaking on Tuesday, and I just want to take a look at some of the things he had to say about that. Ladies and gentlemen, let's take a look. Mr. Prime Minister, we are here on Grand Bahama Island. Cabinet has just met, and we are headed to the groundbreaking of the new Freeport Health Campus. I want to talk to you about your vision for healthcare in the nation's second city.
Well, as you would be aware, the health infrastructure in Grand Bahama was severely damaged following the passage of Hurricane Dorian. Even prior to Hurricane Dorian, the physical infrastructure for healthcare delivery of services on Grand Bahama had deteriorated. So my vision, firstly, is to restore the infrastructure from which nurses have to work, doctors have to work, patients have to be cared for, and the surroundings under which these services have to be delivered.
There seems to be a really renewed focus and a data-driven focus toward creating the kinds of infrastructure and facilities that meet the needs of Grand Bahamians where they are, whatever those needs might be.
Yes, and so, for example, my vision is to ensure that that telemedicine is introduced, that the data collection is available and so organized that any resident of Grand Bahama, wherever he or she may be, and she needs to have some care, that her record could be accessed digitally, and whatever the situation and circumstances are, they could look at her history or his history, or her or his history, and deal with the circumstance of which was present at the time of her presenting herself for care. And so that is part of the building of what I call the infrastructure. And of course, it's one thing to have the buildings and all of these new technologies engage in it, but we're also ensuring that we have the personnel to be able to effect and use the facilities.
Mr. Prime Minister, one of the major concerns, especially after Hurricane Dorian, was the severe flooding that impacted the Rand Hospital, and I know that has been part of a lot of the decision-making process in choosing the new site, in the design for phase one of the new Grand Bahama Hospital, new Grand Bahama healthcare facilities. You know, how do you feel as Prime Minister, knowing that, you know, under your watch, this sort of storm-proofing, as I'm calling it for the sake of this groundbreaking, the storm-proofing that's sort of taking place to ensure that we don't see a repeat of what happened during Hurricane Dorian?
Well, you know, we have to learn from the experiences of the past. And it was always, it is known that Grand Bahama, Freeport in particular, is very flat ground. It's just barely above sea level. And so in choosing the site, that had to be taken into account. So we've chosen a site that is, that it has some height above sea level, And also in the construction phase of it, it has to take into account the environment, meaning you have to build resiliently. And so, yes, you're quite right in pointing out that it is going to be sort of disaster-proof built.
As much as it could be, I imagine. I guess my final question for you now is, how are you feeling going into the groundbreaking? And if there was one specific thing you want Grand Bahamians who are waiting and watching, who have been, calling for this sort of activity surrounding healthcare, what would you say to them as a final word?
Well, what I say is that, first of all, I'm elated to be presiding over this event today. And this is just a part of my commitment to the Grand Bahamian people during the campaign. This is just another tick in the box of accomplishments from our blueprint of change. And we're not just starting it, we will finish it.
Well, Prime Minister, I want to thank you very much for accommodating us today and really giving us the opportunity to have this conversation with you. Thank you so much.
It is my pleasure, and thank you for allowing me to at least express some of the views that I did, which you will make public.
Thank you very
much for that.
Well, Minister, clearly you and the Prime Minister have a shared vision for healthcare on Grand Bahama. I want to thank you so much for being here. This has been a very insightful conversation. We have more of a closer look when we return.
Advertising marketing, we are a digital billboard company, the largest on Freeport currently and the only dual-sided billboard currently. We offer everything that is needed for you to get your ad up on there. That is inclusive of ad consultation, graphic designing, and of course the lead space for the billboard. As a customer, you basically could determine how much exposure you want. You basically are in control of when your ad is shown and how long it's shown. It basically just depends on your exposure and your budget needs. So our location is amazing just because of the fact that it sits basically right in between the two largest commerce on the island, which is downtown and Queens Highway, as well as being able to have access to a full demographic. You have schools, you have grocers, you have hardware stores, all in the immediate area. So of course our services are not only limited to businesses. We offer the ads for special occasions, being able to do birthdays, celebrations, anniversaries. If you have a crush, put your crush up there. Even parties and events. You can contact us at 727-7750 or at our email, which is hello, HELLO, @ambahamas.com.
Welcome back. Ladies and gentlemen, the discussions surrounding the quality and availability of healthcare services is a nuanced one. I hope that this first show in our two-part series has laid a clearer foundation of where we are and where we hope to go. One thing that does seem clear, however, is the commitment from those at the helm of the Public Hospitals Authority and Grand Bahama Health Services. They seem to want to address the challenges of our healthcare system head on. From their emphasis on tackling manpower shortages by investing in education and training programs to harnessing the power of technology to enhance patient care and access, there seems to be a strategic approach being taken, one that resonates with the urgent needs of this island and the country. It is my hope that this vision extends beyond short-term fixes, focusing on sustainable solutions that will ensure the health and well-being of our citizens for generations to come. I hope you'll join us back here next week as we delve even further into the future of healthcare. We're talking to professionals on the ground and getting perspectives from other major players on the island as we work collectively to create a healthcare system that is responsive, inclusive, and efficient. Till next time, Bahamas, I'm Arabina Apia. Thanks for watching.